Welcome back to the Restoring Darkness podcast presented by the Lighting in Darkness Foundation. I haven't talked a lot about it because we've been kind of tweaking it and working on the Lighting in Darkness Foundation and what our mission is going to be. And I'll have some updates for you guys in January. But Mark Baker's got a mission at Soft Lights Foundation. And I love the report you put out the other day that you shared with me. Mark, give us a quick Soft Lights Foundation update before we go to Steve Mariconda.
Okay, Michael, thanks. Hi, Mark Baker, president of the Soft Lights Foundation. One of our members called me this week and has a ophthalmologist that she visits, and the ophthalmologist told her that they get lots of complaints about LEDs. So our member asked me if I could make some flyer type thing for her to give to the office so that they could have the patients could have a way to submit an LED incident report to the Food and Drug Administration in the US. So I made these bookmarks. Oops. And I can send these out and I'm going to print them. And they say something like, there's 4 different ones. Are LED lights bothering you? Submit a report to the FDA via softlights.org. And our LED incident report collects this data, and then I submit those to the Food and Drug Administration once per month. So I'm excited about this new initiative.
Mark Baker is the man. I just got to say, he's always filled with great ideas. Go to softlights.org. I love that. It's gone beyond discomfort glare. This is wrecking people. It's not discomfort we're talking about. Steve Mariconda lives in Bergen County, New Jersey, about 10 miles from New York City, finishing up a master's degree in public health at Rutgers. His final thesis is on indoor and outdoor artificial light at night, Allen, and its impact on human health and safety. He is a DarkSky International Delegate, one of 3 in New Jersey, and a member of the DarkSky New Jersey Chapter. And he currently makes a living as a nursing home musical entertainer. Isn't that great? Helping out the old folks. He's on Facebook. He's got a website, astra-nj.com. He's got some other things. They'll all be in the show notes if you want to check out Steve Mariconda. Welcome to the Restoring Darkness podcast.
Thanks for having me, Mike and Mark. It's great. I've been listening to your podcast for a little bit, and just really great content. So,
we like being here. Yeah, we always say we don't have fans of these kinds of shows. Get a Grip on Lighting, Restoring Darkness, Lighting Controls podcast. We just have colleagues that don't do podcasts necessarily, or sometimes they even do podcasts, but they're listening to ours because we're unpacking some of the key things. When did you realize that outdoor light at night was something that should be considered for a master's degree thesis on human health?
So I guess I made the decision to make it my thesis probably about a year ago because I was already doing a public health degree it's been about 3 years now, going part-time to Rutgers University. But I got interested in and started noticing light pollution maybe about 2.5 years ago or so. Just noticing that, because I've always had a general interest in astronomy and, I like to go outdoors a lot, hiking a lot. I've noticed when I tried to stargaze, I just really couldn't see anything, or the sky was kind of whitish gray, and was wondering why. So I did some more research and learned about light pollution, saw the dark sky maps on the internet, and decided to go take a trip to the Catskills, which is I guess the closest area that has darkish skies by me, about an hour and a half from New York City, and was amazed to be able to see thousands of stars, and I just got hooked on it. And I just realized, wow, we're really missing out on something here. What our ancestors could always see, the beautiful night sky with the Milky Way and all, and did more research about DarkSky International and stuff, and learned that it's not just the starry skies, of course, it's human health, climate change, it's the ecosystem health. It really, artificial light at night really has an impact on the way that all living things live on Earth. So and then I got more involved with DarkSky International and just, was an advocate and then became a delegate, which is basically just an advocate, but that has it's a main point of contact, has our contact information on the website, and been doing talks and things like that, table events. So yeah. And then I realized that this does have, of course, a big connection to public health. So I'm like, well, this is what I'm super passionate about. I might as well do my final capstone on light pollution since it's so under discussed in environmental health circles.
It always starts with the awe. With actually, should no, I'm wrong. It starts with the pain for Mark Baker. Um, Sorry, I have that wrong. So a large percentage of people that are in this space, it starts off that they were a kid. They used to travel to their cottage. They used to be able to see the stars. They can't see them anymore. Now there's this weird or whitey purplish glow on the horizon that looks like a 5,000 Kelvin Mordor or something. Um, but yeah, usually, but no, with Mark Baker, it started with the health effects of bad lighting. So I guess there's two things colliding here on this show. Why is it a public health issue from your perspective?
I think, all right, so there's two aspects of this. There's just general health. That's where I think circadian rhythm impacts might be for the general population. Of course, some people are more sensitive to glare from lights than others. But yeah, in general, just the fact that we're constantly in like an ambient light setting that's similar to daytime at night, because, that's just what we do. That has an impact, of course, on sleep. There's so many studies that are indicating that, especially blue spectrum light at night is just not good for our, obviously it limits melatonin production, which of course interferes with sleep onset and sleep maintenance. And the second aspect really is the glare, of course, from the headlights. That's something that every time I do a talk about light pollution, like that's the thing that connects with everyone. Everyone thinks these headlights are just way too damn bright. And I did sign that petition, Mark. It's a great one. It's just something that everyone connects with. It's just like these lights are too bright and it's dangerous. It makes your pupils not be able to dilate. Of course, that's not good for driving. So, but yeah, it really comes down to for health, it's really glare, circadian impacts, and I think there's a mental health aspect in terms of not being able to see the stars and things like that. I really think we've lost that connection. So,
Mark Baker, can you add some specifics to that list of the health impacts?
Impacts, yeah. So many of our members have a neurological reaction to the LED light in particular. They didn't have the same reaction to high pressure sodiums. They didn't have that reaction to incandescents. So LEDs is a different kind of light. And so they're having non-epileptic seizures, epileptic seizures. A lot of people have migraines. People with photophobia it's just overwhelmingly intense. Panic attacks, anxiety, and I have some people that call me with thoughts of suicide. The blue light is not appropriate for night, other than the little pricks from the stars, right? Or maybe the moon, the reflected light from the moon. So the blue light, as you mentioned, Steve, is really, really something out of the ordinary. And some people are reacting psychologically and neurologically to that. So where are you getting your research and learning about the blue light? Because is it a controversy still, or is this in the public health arena now? It's a fact.
Great question.
Yeah, thanks for that. Yeah, I totally. Just to touch on the migraines and things like that. My wife actually she has astigmatism, and she gets some weird reactions to lights where she gets visual auras and things like that in certain settings
right.
where light's super bright. So definitely a real thing that's happening. In terms of where the literature is on blue light, I think the most robust part of the literature is just on indoor lighting, night shift work. I'm sure you've heard the nurses' studies and stuff where there's an increased risk of because of the circadian disruption, there's an increased risk of prostate and ovarian cancers, hormonal cancers, essentially.
Breast cancer.
Breast cancer, yes. So yeah, that's where the literature has the most data on, especially the blue light at night, especially when you're supposed to be sleeping. Your circadian rhythm tells you you're supposed to be sleeping. So night shift work in hospitals and such. Yes, there definitely needs to be more studies though on traffic safety and things like that. But I think intuitively and from a lot of anecdotal reports, it makes sense that just really glaring lights, especially blue in spectrum, our eyes react more to that.
Okay, so I just want to be clear, because I really liked Mark's question about the controversy within academia. So our question would be, if I can repeat back what you said. So
yes.
the larger across population effects of increased cancers and sleep problems and these types of things have been proven. So all of us are negatively impacted by blue light at night, and we know that it comes from headlights, street lights, lights in our home, and our phones and devices and our TVs,
Yeah.
right? So we know that that spectrum is all bad. I think where Mark is, and correct me if I'm wrong here, Mark, is that there's also those are like there's also people that are experiencing acute things.
Yeah.
And that's where I think Mark runs into a lot of there's no way someone had a seizure from an LED light in a pole. That's ridiculous. No way that happened. Or I don't care if you're sick, you're blaming it on the lights. This has got nothing to do with the lights. Is there still controversy in academia about some of these more acute, rarer kind of diagnoses that are happening? Or are they still controversy?
So I'm going to dive more into that because I still have a month and a half left to finish my thesis. So I do want to dive more into that in the literature. But I mean, I would say I don't know how there can be controversy on it. I mean, like, because like there's always been like warnings, like, you know, when you watch like a movie, it's a warning, strobe warning, like may cause seizures. Like this is stuff that's been like documented, and the filmmakers are literally putting it in the warnings before a film. So I think this has been a thing for a while. I just, of course, when people are like photosensitive individuals tend in general though, or just people who are sensitive to certain stimuli, there needs to be more representation in the data though overall. Like there needs to be more of a focus in public health. A lot of times too, they focus on things that affect large sections of the population. There needs to be more studies on smaller subsets, I think.
Well, when someone goes to a theater and reads a warning at the beginning of the theater saying this is a strobe effect, so if you're sensitive, leave or whatever, that person that stays is voluntarily assuming the risk of getting an epileptic seizure. What Mark is saying is that I can't drive to my grandmother's house.
Yeah.
And he has, Mark, correct me if I'm wrong here, but there are people, we interviewed a young lady, completely debilitated, can't drive at night at all. Period. Mm-hmm. End of the story. And so is that like, I guess there still is some controversy over whether that's caused by the light or not.
Yeah, but I mean, in my mind, there's no controversy. Like, it's just there's so many documented cases of people not being able to drive at night. My wife can't drive at night. Like, I always have to, because with her astigmatism, the glaring lights, not just from headlights, just glaring LEDs in general, like, 5,000 Kelvin or higher. Like, it's just, she can't do it. So, I mean, there's just a lot of evidence that there's so many people in her position, in Mark's position. It just has to be addressed. And they did not have these reactions beforehand when things were warmer, when they had warmer, like 2700, the halogen lights, and high pressure sodium. And a lot of it, I think, has to do with like the filtering of the light too, like just not having like the exact, like the direct source visible, like the direct diodes. Or even with incandescent bulbs, like having the filament, like the clear glass versus frosted glass. I think the frosted glass is just easier on people's eyes.
That's why people liked 60 watt frosted more than 60 watt clear.
Yeah.
In the old light bulb days. Yeah. Yes. Yeah. You would put 60 watt clear in a lamp with a lampshade. Mm-hmm. You would put 60 watt frosted if you could see the light bulb. That's how that worked.
Yeah.
I know because I sold thousands and thousands and thousands of those. Mark, I keep taking over your favorite show ever. Go. Your turn.
There's so much to talk about. Stephen, so I'm very interested in what you're doing. You're getting into like the right space at the right time. We need you. I have been attempting to contact public health departments, and especially, across the country, but they're not responding to us. When we're telling them that there's this issue with light pollution, increased cancer risk, I'm starting to use the phrase carcinogen because it's on LinkedIn. People are using that word. I'm hoping that city officials will start to react. There's something you can tell them about all these health things like circadian rhythms, and they don't really get what that means. But if you say it's a carcinogen, they sort of perk up. So I've started to use that term. Yeah. Have you seen that term carcinogen in your studies? Is anybody referring it to it like smoking? It's like smoking. It's your risk of cancer.
It definitely is a carcinogen. I mean, there's just this documented evidence about, especially with the nurses' studies and shift work, things like that. I think the problem with like the general awareness in public health is that even sleep, something as simple as sleep, which is so fundamental to health, is not. It still needs to, like, the importance of it still needs to be like proliferate through the public health community. I just feel like with our 24/7 society, like these things get overlooked. Like actually having like real nighttime and real deep sleep. Like it needs to be more. It needs to be more prevalent in public health. But I think it is growing. Like I read a book by Matthew Walker, Why We Sleep, sleep researcher, and it has a big chunk of it dedicated to light pollution and its effect on our health. So,
Is the book one page? Because
uh,
the answer to that
it's very
question is
dense,
because
actually.
you're tired.
Oh, man.
So so I just want to clarify something else too. So fluorescent lights in hospitals and with nurses would often be 5,000 Kelvin and 4,000 Kelvin and have large doses of blue. Is it clear that LEDs are distinctly worse than fluorescents?
So I would say I don't think there's research saying specifically. I mean, maybe more needs to be done, but I don't know. I think a lot of it has to do with just color temperature in general and flicker too, which is something I guess fluorescents and LED have in common, although LEDs flicker more.
No, T8 fluorescents never flickered. So T8,
Oh, they did not?
yeah,
Okay.
the flicker was with T12 fluorescents that operated at 60
Okay,
hertz.
gotcha.
T8 lamps operate at 25,000 hertz.
Okay,
And so they would flicker, their flicker would be between 99.999999999 and 100.
okay,
Whereas
gotcha.
T12 would be between 60 and 100. The light would go
Gotcha.
up and down between 100 and 60%, 60 times a second. With LEDs, that flicker, it's 0 to 100%.
0 to 100, yeah. So that has to be the worst. I mean, I would think. But yeah, I'm going to look into more of this actually. This is good. This is great for forming.
There's an episode on Get a Grip on Lighting with Dr. Arnold Wilkins. Get a Grip on Lighting. I think it's number 9. And it's still audio only. It's back in the audio only days. But he proved that T12 flicker caused health problems. He proved it definitively, double blind, everything done. He nailed the coffin.
It's almost like a small strobe, and yeah, it makes sense that would have impacts on our health because it's like nothing in nature actually does that kind of. I mean, it doesn't do that kind of flicker. So
no. So the impact with which you want to have on the world.
Yes.
Characterize it for me.
I do want to have a really big impact. I really want like the world to realize the importance of darkness and night, like just for our health and for sleep, and realize the importance of connecting with nature in the night sky, protecting ecosystems. Like I do want to have a big impact. Sometimes I get a little frustrated because it takes some time, but to spread awareness, I'm trying to do as many talking events as I can. And I guess with school, it's a little limited, but after I graduate, I mean, I hope to get out there more and do these talks. I'm trying to build like the chapter. It has grown in New Jersey. We have like at least 15 advocates that are doing talks and tabling events. We're talking to municipal governments and even some state officials, trying to get some good legislation passed for lighting improvements. So there are things in the works. Things are happening. I do want the awareness to spread globally, though. This should be like commonplace knowledge about light pollution and sound pollution. It should be just as commonplace as air pollution, water pollution.
Mm-hmm.
It really should be.
Wow, Steve, that was exactly right. So our work. So Michael and I agree that that pollution, light pollution, is pollution. It shouldn't be a sort of thing that's like
it's not a metaphor.
Considered.
No. Yeah.
Right. And so as a pollutant, it can be regulated. We've discovered that the Food and Drug Administration is required to regulate this light pollution because it's electromagnetic radiation. Mm-hmm. So this is one of our efforts, is to compel the FDA to do their job and start collaborating with other federal agencies and all the federal agencies. So NHTSA for cars, the Environmental Protection Agency for outdoor pollutants, environmental pollutants, the CPSC for children's toys and such, Department of Energy for streetlights, et cetera. And so this is one way that we're trying to contact. There's a lot of organizations that do electromagnetic radiation awareness campaigns. So we've contacted them. They're not interested yet. They don't understand yet. And so the what you're getting into is like a big deal. And so this public, I want to come back to your public health thing. And so, do you have like what's a job then that do you see yourself? I mean, you're already doing amazing things, but so what do you see yourself doing as like a career to start? I
So
guess.
I guess there are a couple avenues. I mean, for I would love to eventually work at DarkSky International. Uh,
Oh,
we'll see someday. That would be great. But also, like I could do work for the New Jersey DEP, Department of Environmental Protection. I've already been in communication with them about because with other projects I've been doing with like lead mitigation and Trenton and things like that in the soil. Um, so I want to if I could work for like public health departments or environmental health, things like EPA, like I could expand awareness there and make it more of a priority. So yeah, there's a
The
couple
good
avenues.
news,
Oh, you go ahead, Michael. Steve, we just met, right? But I've been doing this for a while, and there's a lot of political stuff that you have to go through, and you got to fight. You, are you in for that?
Yeah. I mean, it already has felt like a little bit of struggle. Just getting my mayor and council to like take this seriously, and we're trying to get an ordinance through in my town. Which actually, the more you show up to these mayor and council meetings, the more they're receptive to your message. So I've been giving them
That's true.
literature and things like that. So I mean, we're making there is like a draft ordinance in the makes, not for residential right now because I feel like I haven't done enough awareness raising among town residents. But if it can be done for street lights and for like municipal lighting and business lighting, that's a start. So yeah, it's one of those things you just got to keep chipping away at it. And
does Bergen County already have an ordinance?
so they don't have the county. There's no county-wide ordinance on light pollution. I have tried to go to the. I'm trying to get something done with county parks. That's one area where the county.
What I'm saying is there
Yeah.
one that you already have?
So in New Jersey, there are a couple of municipalities that have like light trespass ordinances. So that's good. I'm using that as like a reference, and I show that to my mayor and council. I'm like, look, this town, Ridgewood, New Jersey, they're in Bergen County, and they have something about how much lumens can spill into other people's properties, things like that. So, and there's even some towns that actually have like things like all streetlights must be 2,700 Kelvin, full cutoff. Like, and in New Jersey, in fact, has legislation pending about just any new state-funded lighting projects have to have like certain standards, 2,700 Kelvin, full cutoff. So there is like sample legislation that I'm trying to pass around, like trying to make it as easy as possible for legislators to just be like, okay, we can adopt this as is. Like,
Yeah, the problem is that it's not that simple.
it's
So
not.
the this I don't want to get into a big thing about the alphabet soup in the lighting industry, all the 3-4 letter agencies out there that have failed us. I don't want to get into a big thing about that. Mark Baker might go off. But when can we please get away from single metric laws and regulations and accreditations? Like, this has been a catastrophe for the lighting industry. These single metric lumens per watt. Yeah. We figured it out. Now we can make a whole bunch of money charging people for accreditations. And now it's 3,000K. Then it's 2,700K. Then it's going to be 1,900K.
Yeah.
Then it's going to be 2,200K. There's going to be all these different things out there. And the fact is that it's not just the color temperature. And in fact, color temperature is the wrong metric to use anyway, because you
Especially
can still
with
have the
LEDs,
blue
yeah.
light in a lower Kelvin temperature.
Yeah, because the high CCT, right? It still has some blue light in there, even if it's 2,200
No.
Kelvin.
Kelvin temperature is the wrong metric. You need to use nanometers.
Oh yeah. Okay, I got you. Yeah. The spectrum, the actual spectrum.
Yeah, like they're talking about the wrong metric.
Yeah,
You know?
I mean, especially with LEDs, it's not like we're heating up a black body temperature anymore. It's different. Yeah.
Yeah, they're not using the right metrics. But we have to acknowledge progress when we see it.
Yeah.
So you plan to make money working for the Department of Health or at the Dark Sky Association. You can take Ruskin's job. Ruskin, look out. Steve's coming for your gig. I'm just joking.
Michael,
Always.
I was going to suggest head of the FDA or head of the CDC.
Whoa, there you go.
Those would be for somebody
I mean, like the
Steve.
big regulatory agencies would be just a good place to spread awareness because, yeah, they have a huge impact, of course, on policy and behavior. Yeah.
Well, what kind of legislation do you think that we could propose at the local level? And then the opposite, is there some kind of legislation that could be proposed nationally from a Rutgers public health education perspective?
So locally, I mean, in terms of just simple legislation, like they actually, DarkSky International just put out a new model lighting ordinance. There's a couple versions of the model lighting ordinance. Some states have specific versions that are fit to their like building codes and things like that. But I mean, just essential like regulations about like especially for business and municipal, like all lights should be fully shielded or full cutoff, right? Um, and certain limitations on how much blue spectrum, right? And I guess how many like how much illuminance, like how many foot candles, etc. I mean, I know it can get pretty complicated, like especially for planners and people who are not lighting designers, which I am not, by the way. Like it can be, but we just need simple regulations about like just an awareness of light pollution, like trying to keep the light on the ground and trying not to have it too bright where it can cause glare, like filtration, so you're not exposing direct diodes to your eyes, things like that. And in terms of federal legislation, I think you can take the same concept and broaden it to however big of a jurisdiction. Really, there just needs to be an awareness. I think it is a lack of awareness. Whenever I do talks about light pollution, people usually will get it right away. They'll be like, "Wow, like." So it's just they just didn't know about it. They haven't given it thought. They got other things going on in their lives. So.
Yeah. Well, Mark, it looks like we have our first budding future public health professional who agrees with Soft Lights Foundation.
It's fantastic. Yes, I don't recall meeting somebody doing exactly what we need, Steve. May we be in touch after this show?
Oh, absolutely.
Okay, that's terrific.
All right.
Michael considers me a firebrand, so watch out, but we are aligned.
I consider Mark more of a wild man.
A wild man, firebrand.
Steve,
we need these voices. Yes.
Yeah, Steve, we're gonna close it out here. Do you have any final thoughts for the Restoring Darkness listeners out there that you want to share with them?
I guess so. If you want to check out the New Jersey chapter from DarkSky International Facebook page, you can check that out. We're I don't know. I'm glad you guys had me on, and just trying to. I appreciate what you guys are doing. We just got to keep educating the general public, I think, about light pollution. And as you've mentioned, Mike, like the lighting industry, like there's so many different players here, but just a general awareness of light pollution in the population will, I think, bring on some progress here. So.
Yes, unfortunately, Mark, we're still in the awareness creation phase 1.
Yes.
It is what it is, and there's nothing we can really do to change that. But if you wanted to help, you can go to restoringdarkness.com and donate to the Lighting and Darkness Foundation. That would help. You can go to softlights.org, sign petitions, donate to softlights.org. That's always a good idea if you want to help out people. Like Mark's paid hundreds of thousands of dollars of your own money, Mark, into this.
Yeah. The major lawsuit that we funded was $75,000.
There you go. You can fund a good man. In fact, you know what? Skip Restoring Darkness. Go right to Soft Lights. Give Mark Baker a donation. He's doing such great work down at softlights.org. I want to thank Steve Mariconda. All his social media, website, all that will be in the listener notes at the end. You just go down and find him there and click on it. And for you out there, all you budding advocates, all you lighting people listening to this, let's go with this thing. Bye for now.